3 years ago, no service existed, and these nurses have come in. They had no transplant nursing experience. They've had to learn everything that's been required, and it's quite a complex area. They've had to draw up their own protocols. They've put in nurse-led clinics. They've put in annual review clinics. They run an immunosuppressive service. They answer all the patients' queries.
The engagement that they have with patients, I think, is remarkable. The fact that they can remember everyone's name, and there's a genuine concern about your health and welfare. And the thing I particularly like is the follow-up from a clinic, so that if anything needs to change from your medication or you need to come back for another test, they're straight on the phone.
It means everything to me, because I can phone up if I have any concerns whatsoever. They reassure me on the end of the phone. They'll arrange for me to have any tests, and I just know that they're there, and it's very reassuring.
The Band 7s and 6 now sit alongside the consultants in outpatients, doing exactly the same job as the consultants, and that's pretty impressive in that short period of time.
Hospital at Home is a service that the Trust introduced at the end of last year. It aims to take patients traditionally looked after on the acute wards who still have acute needs and transfer the care to their home and look after them in the patient's own home.
Currently we have 21 nurses within the team. We cover the 3 sites, Margate, Ashford and Canterbury, and obviously all the villages in between. All our nurses are very skilled in what they do. They are of a higher grade, so they can work on their own. They can give the service that is required, and they can take on more complex patients should the need arise. We've had patients that have even written to the Prime Minister because they're so pleased with the service.
The patients have had an overwhelming positive reaction to it. They love being in their own home and in their own environments, and they're eating better, sleeping better. They're also benefiting from a one-to-one level of care with the nurses. When the nurses are in the patient's home, they get their undivided attention.
It suited me very well to be allowed home, because however good the hospital is, it's much nicer to be home, isn't it? When I get home, I feel I'm all right.
I am so proud of all the Hospital at Home team, because they have taken this service, they've made it their own, and they've actually made it blossom. They do everything with a smile. They are very patient focused. From interview, these staff just shone. They were positive. They wanted the service to work, and it has worked, and it's through their hard work and dedication that the service has just gone from strength to strength, and I hope it will continue to flourish, which I'm sure it will.
Dermatology Team are a really strong team, and they have a lot of challenges in terms of day-to-day delivery of a service that is routine referrals, as well as urgent cancer referrals, as well as specialist surgery, as well as treatments by nurses, etc. And on the background of that, their whole service was effectively thrown up in the air by commissioners, and we as a trust had to bid to retain parts of the service. Now, in a normal way, people could seem very threatened by that and feel that change or service improvement, whichever way you want to take it, is quite challenging for them. The Dermatology Team embraced that and actually redesigned their service so that the wishes of the commissioners was met in terms of providing community services, as well as retaining those highly specialist acute services. What that actually meant was loyalty, and I think that's really important to stress, and why I think this team really needs to be nominated, because the consultants were approached by private providers and were encouraged to leave our trust and set up competitive services. They've stuck with us and actually really said that they want to take forward an integrated service. As a result of that, we've delivered fantastic services for patients in many more locations, which is exactly what we wanted to do, and maintained our standards. Yeah. But on top of that, the nurses had to change the way they worked, had to go out into the community, change their locations, as well as all the booking teams. I mean, a massive amount of work was done to change all the clinic templates, to rebook patients, and actually provide a completely different service. So it's a real team effort, and that's what I'm talking about, is every single member of that dermatology team has embraced the change, moved to it, and made those significant improvements.